How's it going, everyone? Welcome back to another PT Pearl from the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we're going to be talking hip flexor tightness. Everybody talks about the tight psoas, the iliopsoas muscle, and what we can do to release that hip flexor tightness. Stay tuned. When we start talking about hip flexor, everyone first goes to the big hip muscle, which is this iliopsoas or psoas muscle. People might recognize that, just the psoas. We need to release the psoas. Understanding where and what the psoas is and what the iliopsoas muscle is, I think, is kind of an important place to start.
Yes. So realize that when we say iliopsoas, we're actually talking about two different muscles. So there is the iliacus, which only connects from the upper leg. So think of it's the lesser trochanter of the upper leg, but you don't need to know that. Just think of the bone, the big femur bone in the upper leg, so that thigh area. And it's connecting into your pelvis, actually.
Yeah.
So the iliacus, it connects into the iliac crest of our pelvis. So it's just going from our pelvis to our upper leg. Now, the psoas muscle, that's the more famous one, which is going to connect all the way from that top of that femur bone, so that top of that thigh bone, past the pelvis and into the low back. When we say tightness, we're usually thinking of a shortened position as well. Like the muscle is just resting in this contractured, shortened position, and that is why it's pulling on that low back. So if we think about it, again, if you think from the upper portion of that thigh area all the way into that low back, and if you were to take like a string between those two areas and pull it together, that would cause that lordosis type of positioning. So that's when you get that good Instagram booty pop. That low back goes into a lot of extension, that and it's like the top of your hip bone. So think of your hip bone coming into your thigh. So that is what it is doing when that psoas muscle is getting shortened. But now we have to realize that, is it really a contracture? Is it really like in a shortened position? Or is that neurologically where your body says, oh, this is safe. This is where we rest. And we also have to realize too that the hip flexor does not just do hip flexion. No. It's not just pulling that lumbar spine, that low back into your thigh, right? Again, that's only where the psoas is going to connect. So the iliacus is going to connect a little bit lower than that. But besides just pulling the knee toward the chest, so that's hip flexion. Besides just being able to do hip flexion, it's also going to do hip external rotation. And external rotation, some ways that we can think about it, like think you're sitting and you're going to cross your legs.
Or if you're sitting in that butterfly type position, then your knees are kind of falling outward. Our hips, if you're paying attention, are kind of rotating outward into that external rotation.
Exactly.
And like Jen was saying, that's just a product of the hip flexor attaching a little bit more on the inside of that femur bone so that it can also rotate outward.
And it kind of helps us sit up. So kind of getting that trunk flexion.
Especially if someone's sitting on our feet, because then our femur's holding steady. So then we can pull up our trunk with our hip. Yeah.
And it also does some side bending as well.
Totally. And I think that's a product of, if we're looking like, okay, what's the hip flexor moving? Is it moving the leg or is it moving the trunk?
Right.
And if we're using it to move the trunk, that's when we're going to be doing side bending rather than external rotation of the hip.
Yeah.
So they're kind of complementary motions with each other. Tightness, maybe that hip flexor also needs strengthening, also needs to learn how to coordinate that strength through the range. Like, how do we start to approach that? Because I also think we start having other issues with coordinating of all the other muscles in the area.
Oh my gosh, it's so much. And that's why we can't just say, okay, my hip flexor is tight. What is the one stretch that I do? What's the best tool to release it? Because although it's feeling tight, if that's where your body neurologically likes to be, that is what it knows. This is, you stand and you're maybe more in that lordotic position, meaning those hips are kind of dumping forward and you got that anterior pelvic tilt. If that is all the body knows, the moment you stretch it, think of like a rubber band. You're going to stretch it. What's it going to do if you let go? It's going to go right back to that position. So even if you did a lot of stretches, even if you did a lot of releasing, if you don't teach your body how to resume a new position and actually feel comfortable and safe in that new position, it's going to go right back. And so you can do all the stretching, and there's a lot of people I'm sure who do that. Like I get it released and I do a lot of stretching, and it's still the same, or I'm still dumping into my low back, or I'm still feeling the same tightness and tension in the front of my hips, and that's where it comes into play of like, we need more.
And this is where I should poll the audience if you've listened to our podcast before, how do we make the body feel safe? It's coordinating, letting the hip get into these more lengthened positions with our breath and our other patterning that helps our body say, okay, this is safe. We're supporting you otherwise. So that's where you're doing, yes, a functional lunge stretch, but you're really breathing. You're controlling down through your rib cage, focusing on engaging in your low abdominal area, because then that's going to work together to make that hip feel safe, lengthening or stretching that hip flexor, right? But it's done in coordination with everything else going on.
Exactly.
But even then, that's not where we end.
Right. That's not enough. So although we can make the body feel safe, like, okay, it feels better in this lengthened position. And this is also where I go back to, it's not about 3 times 30 seconds.
No.
3 times 30 seconds is really not a good judge for how you're going to feel safe within the body. It doesn't automatically 30 seconds goes off and your brain's like, cool, I feel good in this position. Really what we like to say, one, it's dependent. Every person is different. It might take one person a minute to feel like their breath is actually connecting and they are feeling that down regulation and that tension release in the muscle. It might take someone 5 minutes. There's a difference in what you're feeling. But now once we get that brain to connect and say, oh, and you feel that tension, you would feel that tension release. So if you breathe into it well enough, and you can go back to our breath podcast to really learn about this. If you get that tension release from the relaxation from that breath work, then we can't, again, like Dom said, we can't stop there. So where do we go?
Well, then we have to learn how to, from that lengthened position, how do we show the hip how to especially control resistance through that whole movement? Because think about it, if we're standing and we pick our leg up, we're lifting the weight of our leg. And a lot of that comes from hip flexion, right? So then how do we coordinate that when we start walking? Because we'll be doing this amazing stretch. All of a sudden we'll get up, we'll realize we're late to pick up our kid or something, and we'll run for the door and immediately flip ourselves back into this safe position, position that we know that is comfortable for our body. So then we get to start working on coordination exercises, where we go into, what can we do with the core to make sure we're supporting through the core while we introduce some hip motion. And a lot of the times for us, that looks like laying on your back, doing low abdominal core exercises, and doing little leg lifts up and down.
Yeah. And this is where it's not just about, when we talk about the core, you have to realize that when we talk about that foundational, we're going to go back to it over and over again. The core in the inner core is made up of the diaphragm, the pelvic floor, the front of the body, so more of that transverse abdominis, that low kind of wrapping corset muscle of the core, and then the back. Okay. And so you have to get this inner function with the breath, usually, to be able to function well before we get the outer core, the rectus abdominis, that 6-pack muscle, the obliques, and then programming with the hip flexors. So when we can get that inner core to work, and we go over this like mad in the optimal body, like that is the core of the optimal body. It's not about your pretty 6-pack muscles and how to get those stronger. It's really how to build from this foundation so that you can then start to move with the hips and have that hip flexor not doing all of the work. And
also we know that hip flexion is paired a little more with internal rotation of the hip. So what's our internal rotation look like? And this is where, if we go to one of your favorites, the 90-90 hip stretch, or doing something to explore how your internal and external rotation are on your hip, just working on that alone could help you start to feel the front of that hip freeing up, just because we're working on another motion that may actually be your biggest barrier.
Because they are so interconnected, you cannot be just paying attention to the hip flexor. And this is also why when we talk about diaphragmatic breathing, getting the diaphragm to actually be able to work. So we talk about this a lot. So the diaphragm pumps up and down in order for us to breathe, right? And we're always breathing. You're listening, you're breathing, right? But are you allowing space for that rib cage to actually be able to pump up and down? And that's where that rib cage stuff comes in, which again, we talked about this so much on the breath podcast. So going back to that, but also when we get more into this diaphragmatic breathing, what we're doing in turn is flipping the switch on the nervous system, and we're getting more of a parasympathetic response, meaning we're getting that down regulation, that rest, relax, digest, and release of tension. So if I just get my diaphragm pumping and get more into that diaphragmatic breath, not only does that attach into my psoas, but I'm also down regulating my entire system. So automatically I'm going to feel less tension in that hip flexor as well. And this is why, so now let's talk about tools that you should use to release the hip flexors, right? The thing is, when we're looking at anatomy, if you look at where the psoas and the iliacus are located, they are deep structures. They're deep muscles.
Yeah. It's not realistic to say that you're only pressing on that muscle.
Yes.
It's not realistic to say that you're only impacting that thing, because our femoral nerves and artery come out in that area. All of these, it's like a minefield. Like if you press in on those, our lateral cutaneous nerve, like you'll feel all these paresthesias or tinglings on your thighs, like if you hit the wrong place when you're digging into those nerves. So to say that I'm only impacting the psoas muscle, no, you're probably impacting the whole femoral nerve complex, which supplies a lot of the muscles on the whole front of the leg down through the calf and stuff. So,
and we have to get through the abs. We have our obliques, our transverse abdomen. We have so much
organs too.
We have organs in that area.
That are up in that area.
It's it's really crazy to think that we're just going to use a tool. So what do we actually like to use?
Going back to the breath and the diaphragm, one of our favorite things is the Coregeous ball.
Yes.
Which you probably see, or you may have seen Jen or I use, but it's just this kind of inflatable ball that you lay on, and it really presses up into your abdomen. And the thought is that we're kind of, as we're breathing, becoming more aware of and influencing what we're feeling in those tissues deep in our abdomen, which, as we just talked about, includes the attachment of the diaphragm and the attachment of our ilios, or our psoas muscle, the psoas portion.
And when we're doing that and we're getting that good kind of rubbing on those tissues in kind of like this digestive area, we actually help to kind of stimulate the vagus nerve as well. And when we stimulate the vagus nerve, this is another nerve that's going to help to promote that parasympathetic system to help relax, digest, and really release that tension within that psoas. So you really want to release tension. You really want a tool to do that. That's where laying and breathing on the Coregeous ball 2 minutes every day, it makes one of the biggest impacts on all of my clients that I have.
Absolutely.
Thanks for joining us on another PT Pearl from the Optimal Body Podcast. Don't forget, we have the full episode, so a lot more education than we kind of drop in on this YouTube channel on the podcast. So go listen on your favorite podcast so that you get the full episode. And if there are other things you want to learn about, please let us know in the comments below. Subscribe so you don't miss out, and you get all the visuals from the podcast here.